I'm Mary Caffey for the American Journal of Managed Care, and I'm here today with Lindsay Baylor Greenleaf, Vice President of Policy at ADVI, to discuss the 2021 Medicare Advantage rate announcement and how COVID-19 has affected Medicare Advantage. Welcome, Lindsay.
Hi, thanks for having me.
Before we get into the specifics of the 2021 rate announcement, can you discuss the growth of Medicare Advantage in recent years and what that's meant for health plans?
Sure. So Medicare Advantage continues to grow each year with enrollment doubling over the last decade. Currently, we have 24 million enrollees in MA plans, and that represents about 38% of all Medicare beneficiaries. So we expect this growth to continue. The Trump administration continues to give MA plans a lot of flexibilities with their benefit offerings and with tools to contain costs, which helps them to keep premiums low. So as long as MA plans are able to provide beneficiaries with more choices and keep premiums relatively low, they will certainly be a popular choice.
One of the biggest concerns we hear from seniors and everyone is the cost of prescription drugs. Can you talk specifically about how Medicare Advantage is encouraging better formulary management?
Sure. So one of the biggest recent changes in MA plan formulary management has been with physician-administered Part B drugs. Back in 2018, CMS released guidance allowing MA plans to impose step therapy for these physician-administered drugs. They could do that beginning 2019, and they're still able to do that now, and will continue to going forward. There's been a lot of patient and provider pushback on this new ability to do step therapy for Part B drugs. When you think of Part B physician-administered drugs, you think of cancer patients, rheumatoid arthritis. These are some of the more complex and debilitating diseases. So a lot of pushback from the provider and patient community. However, we have not seen CMS back down at all. Expect for this, to continue to be a new tool for plans to use now and going forward in Part B. Another more positive from biopharma manufacturer viewpoint, a more positive utilization management tool that plans have been using has to do with guideline adherence. The National Comprehensive Cancer Network and United Healthcare partnered up to do a study, and they found that simply reminding physicians to adhere to specialty society guidelines could reduce total drug costs by 20%, which is obviously a huge reduction in costs. Guidelines are not new, but just as the debate around drug costs and controlling these costs continues, we expect that guideline adherence will continue to get more and more attention from plans.
Yeah. In fact, CMS has asked, as part of the rate announcement, they asked for feedback on several specific issues related to the Part D program, including prior authorization. So what do you expect the questions about that to involve in 2021?
Sure. So in the rate notice, CMS explained that they are working on a Medicare Advantage star rating related to prior authorization, the star rating measure, excuse me. This measure will judge plans based on how well they're implementing prior authorization processes, how well a beneficiary is still able to get access to needed care, even when a prior auth is in place. So we think this is a great addition to the Medicare Advantage star rating program. In addition to working with biopharma manufacturers, I work with a lot of oncology practices, and all these oncologists have so many horror stories about being on the phone for hours with the health plan, trying to get through the prior authorization process. The person they're speaking to on the other line is often not a physician, and if the person is a physician, they're often not an oncologist. So prior authorization can cause some real headaches for both providers and patients. So it's great to see that CMS is working on a star rating measure on this. So we'll be looking to see what that measure looks like. I think also going into 2021 and beyond, when it comes to the Part D program specifically, we pay close attention to the Part D appeals process. The process by which if a beneficiary is faced with prior authorization or step therapy, or if the plan just simply denies coverage of a certain drug, I'm talking about that process that they can appeal those decisions. Currently, and thus far in the Part D program, this process has been very beneficiary friendly. by and large, for the vast majority of appeals, beneficiaries usually win out and they're able to get access to the drug that they want, so long as they're willing to tough it out through the appeals process. So when we're talking about Part D access, that's an area we're closely watching, looking to see if stakeholders ever ask for changes or if CMS signals they might make any changes to that process.
I'm glad you brought up the oncologists, because we heard from them too when the step therapy rules were first put out. Do you think that this process that we're going to go through with the feedback, will this give the oncologists a chance to maybe tell some of their war stories and strike a little bit of a balance between the step therapy provision and what the oncologists are looking for?
Certainly. The oncology community has been very vocal, talking to CMS and the agency about some of the issues they're facing. And I think they're going to continue to do that. CMS has been receptive. They just haven't gone so far as to, formally reverse course on allowing for step therapy. So we haven't gotten that far yet, but that dialogue's ongoing. And I think you'll continue to see the oncology community push for changes there.
You mentioned earlier all the flexibility that CMS has given under Medicare Advantage, and really has given, it seems they're really encouraging enrollment in Medicare Advantage to allow plans to kind of customize some of the services around chronic illness and some of the other conditions, that nutrition, all kinds of things that people may need. Do you expect more of these announcements?
Certainly. So to promote the Medicare Advantage plan enrollment in general, yes, CMS has shown they're trying to be as flexible as possible with MA plans. I think in today's environment with COVID-19, we've seen a flurry of activity coming from CMS, giving health plans all sorts of new flexibilities. I think one of the biggest areas where we're seeing a lot of new flexibility is around telehealth. Now, throughout this COVID-19 pandemic, providers can get paid the same rate as a face-to-face visit if they use telehealth with a patient, so long as there's an audio and video component involved. That's a huge change. That's something the digital health community has been asking for years, and they hadn't gotten very far. This is a big shift, and it's an example of flexibilities that plans are given right now, and we expect for some of these flexibilities to continue after the pandemic is behind us, depending on how well this all plays out, and providers and patients report favorably on these new telehealth flexibilities. So yeah, that's one area that CMS has already provided great flexibility, and we expect it to continue.
Yeah, we're hearing the same thing, that people already love the telehealth provision, and that once people get attached to it, it's probably not going to go away very easily. So what do you think are the biggest tests ahead for Medicare Advantage in light of COVID-19?
So the biggest challenge for plans going forward here is going to be that balance of providing COVID care while being able to implement their traditional cost containment measures like prior authorization, like what we're talking about. In this environment, it's really hard for plans to say no to anything right now. And that's obviously going to have repercussions somewhere, and it's going to end up being increased premiums. So plans are going to be in a real bind, and that's, this is what they're focusing on right now, and will continue to focus on the rest of the year, is how they can best control these costs while still making sure that their members have access to the care they need.
Well, Lindsay, thank you so much for joining us, and we'll have to talk to you again as the 2021 process gets underway.
Thank you. Great talking to you.
Thank you.